the neurochemical imbalance is somewhat debunked. Let's go with that. Now there's more and more. Your book did a great job of debunking it as well. So some would say, all right, then what is my cause of my depression? Can we go into some of those?
Yeah. So even in the study they did, what they found, what keeps being found over and over and over again is it comes back to primarily, so there's lots of factors. Let's start there. There is no one factor.
Right.
But the biggest factor are these early childhood experiences of trauma and stress, which dysregulate the nervous system and lead to all kinds of consequences. It does lead to an imbalance in the brain. It's not a particular one. It causes, our limbic system becomes more reactive. Everything, it changes the way we think about ourselves. It changes the way we think about the world. What is just neutral suddenly becomes threatening. I mean, even with everything going on right now, right, all the fear around everything and the polarization, right? It's even people without trauma are being traumatized, and in the sense that their nervous systems are getting amped up and reacting and causing this chronic stress pattern, which leads to all kinds of consequences. There's pretty much all chronic disease, and it can manifest emotionally. It can either be both or one or the other, but it's having an effect for sure. But these early childhood experiences are pivotal because it changes the way the brain forms and functions. And leads to this chronic pattern. But the good news in all this is, right, if that's what's causing it, and that's what more and more evidence shows, is, right, we can change that. We can totally reverse some of these changes. And it may never be the same as someone who hasn't had trauma, but it can certainly be reduced to the point where the nervous system doesn't have to be as amped up, as chronically vigilant.
Yeah. I mean, when you talk about that early childhood trauma, and then you look at what's happened in the past 2 years, and I have a niece and nephew that are very young and gone through this pandemic with some fear, right? And not going to school, not seeing friends, that can be traumatic for some children. Do you then think we are looking at, if we don't do what you're saying and start to address these things, that we're looking at what we've already kind of seen in the numbers, an increase in the amount of children and grown-ups as they grow up with depression and anxiety?
Without question. And it also becomes intergenerational, right? We know that trauma gets passed on intergenerationally, even big traumas. I was just reading, I actually haven't finished it. I saw it, I saved it. It looks so interesting, right? But the study is showing that, I don't remember which hurricane, but during another hurricane, the children in utero have higher levels of depression and anxiety, which makes sense because if the parents are, especially the mom, because the mom's carrying, if the mom's stressed, she's changing the whole, right? Her chemicals are influencing the formation and of the child. And so that then changes the epigenetics, which gets passed on. And then it keeps getting passed on unless we take responsibility and learn how to kind of turn those off. And there's so many ways to do that. Breathing and meditation and any kind of mind-body stuff, and being outside in nature and healthy eating and all of that. All of these things can change these genes, but we have to take the responsibility to do it.
We do.
And that is way harder than a pill.
way harder. And I understand it's the easy way out. It's simple. Like you said, some psychiatrists it's simpler to just explain it's an imbalance and just take the pill and you'll be better.